Hello, I'm Peter Ndora. Welcome to this week's edition of Health Talk. Now, today is day 93 of South Africa's national lockdown and day 27 at level 3 in response to the COVID-19 global pandemic. So what's coming up on the program today? Well, we'll be joined by the Acting Chief Director for Child, Youth and School Health from the National Department of Health to speak to us about the symptoms of COVID-19 and how to take care of yourself and your family during self-isolation at home. We'll also be speaking to the divisional head at Ezinja, a subdivision of WITS's Reproductive Health and HIV Institute, about Dexamethasone, there you go, a steroid drug hailed as a breakthrough for seriously ill COVID-19 patients. And we'll also talk about the first historic COVID-19 vaccine trial that's being done on the African continent. That's all still to come. But first, let's hear from our senior producer, Zama Budelezi, who'll take us through the latest South African COVID-19 numbers. So very good morning to you, Zama.
A very good morning to you, Peter, and our viewers. The first clinical trial in South Africa and on the continent for a COVID-19 vaccine was announced this week at a virtual press conference hosted by the University of the Witwatersrand in Johannesburg. As we enter winter in South Africa and pressure increases on public hospitals now more than ever, and a vaccine is needed to prevent infection by COVID-19. As we await the outcomes, let's take a look at the national COVID-19 statistics. So far, tests conducted in the country, 1,493,104, 124,590 positive cases have been recorded. 64,111 people have recovered from the virus, but sadly 2,340 people have since passed on from the virus. 58,139 active cases have been recorded. Let's take a look at the provincial statistics update. The Western Cape is bracing itself for a coronavirus death rate of 60 people per day. This as the province prepares to move into the peak of the pandemic towards early July. Already over 1,500 people have died in the province, the highest COVID-19 death rate in the country. This province has the highest numbers of deaths and infection at 57,941, followed by Gauteng at 31,344, Eastern Cape at number 3, 21,938. While addressing the media this week, Gauteng MEC Dr. Bandile Masuku spoke about the issue of backlog at the country's laboratories. Let's listen to the MEC.
The backlog, it's only 30,000 specimens that we are going to test. We have received permission and concession from the NHLS to be able to retrieve them and take them to private laboratories who have the kits. So we are clear that with the provision that we have and with the availability of the kits in the private sector, we will be able to complete the backlog. And it's an agreement that we reached. And the specimens, as we are speaking, they've begun actually doing the testing, because we are also worried that we don't want to create an artificial surge in terms of the confirmed cases. And also, after we've done the backlog, we'll also give the public the age analysis of the tests that we've been done, the outcomes of the tests that we're going to do on the backlog, so that you understand, the public understand, and we also understand the age analysis of those who have been confirmed positive, how long they've been positive, and when the specimens were actually taken. So in all, we are going to use private laboratories capacity. It's not only the big 5 that have been used, we are also going to use other small black-owned companies which are already having the kits. Indeed, NHLS did provide a whole lot of support in terms of clearing the backlog in Western Cape and Free State and Eastern Cape. And now part of it is that in Gauteng they've already started, but we're also helping them in that regard to make sure that we don't get the backlog going forward.
Let's continue with the provincial statistics. KwaZulu-Natal standing at 7,090 cases, Northwest at 3,218 cases, Free State at 1,069 cases. Mpumalanga recording 855 cases, Limpopo at 798, the Northwest Province at 337. While other people infected with the virus won't present any symptoms, COVID-19 symptoms include fever, coughing, sneezing, and shortness of breath. If you believe there is a chance you may be infected, call ahead to seek medical help from your healthcare provider or use the public hotline 0800 029 999 and alert them to your symptoms. Wash your hands with soap regularly, use sanitizers with 70% alcohol content, and wear masks when leaving the house. Wash these masks with soap and water after use. Stay at home, and if you have to go out, observe social distancing all the time. This is just to make sure that we keep ourselves and others safe and healthy. Back to you, Peter.
Zama, thanks very much indeed. Now, just to remind you that those statistics we do observe and report all the time regarding the COVID-19 cases. These numbers can change, and sometimes significantly, as you might have been noticing in the past few days. Okay, now remember, you can also be part of the program by asking the guests that we have on the show some questions, and we also share whatever is on your mind. And all you have to do to talk about what we're discussing is call the number, and that number is on your screen now. It's Johannesburg 011 714 6841 or 6842. Okay, that's the number to use. Now, every week we ask you a question for us to answer or share with us. And our question for you this week is, what has been your experience with isolation after testing positive for COVID-19? And what treatment did you use? What did you do to manage those symptoms if you had any? Well, you can send us your voice notes or video messages to our WhatsApp number, and that's 065 862 4548. That's 065 862 4548. And please try and keep your messages short, under 30 seconds, so that we can get as many as we can get. Now, you can also share your thoughts with us on social media via Twitter, and you can use our handle there at SABC Health Talk or hashtag SABC Health Talk, or on our Facebook page, and that's simply SABC Health Talk. So, Health Talk continues right after this break. Stay with us.
Nikile, thank you so much for talking to us and sharing your story. Tell us about the events that led to your mother having to go and seek medical attention. What happened?
I got a call telling me that my mother, she went to the clinic for testing for corona because she had a short breath. So I didn't see her own symptoms whatsoever. After I came at home, I went to her room. She was already on isolation. I spoke to her. Then she told me she went to the clinic, and then she asked me to speak to my siblings, of which I did. They were crying because it wasn't easy, because I had to tell them the real actual thing which is happening and what we might even face going forward.
When did the results, your mother's results, come back? Was she diagnosed? What happened?
My mother's results came back on the 14th day. Remember, I got my ones on Saturday, and then her ones came on Monday, on the next Monday after Sunday. So that time she was already like 90% recovered. Automatically, we just assumed hers will also come back as saying she's positive. Eventually, they came as positive. Then at that period, myself and my wife were sick at that time. She was also struggling to breathe. She had also kind of short breath, the chest pains and the body pains. And the sad part is she could not use any medication because of her circumstances.
You tested positive, your mom tested positive, your pregnant wife now has tested positive. So how did you go around doing the isolation, because there were also other people in the house?
We are 7 at home, by the way. So my mom was on her own room, and then me and my wife were on the separate room, and the kids were also on the same separate room. So what happened was, during that period when my mother was away, myself and my wife were doing all the other things at the house.
Tell me, Nikile, do you feel that not much information was given to you, especially when your mom came back and you had to take care of her when she was told to go and isolate?
The information that we got, I would say it's legal, but it was valid, that she must stay on isolation, we mustn't make contact with her, of which we are aware of that because we've been reading on the news, newspapers, listening to radios.
Do you know how you got infected?
I didn't follow the precautions. I think I was too angry. I was too frustrated because, like I said, I only touched her on a Wednesday. So that Monday and Tuesday, the whole days, 2 past days, night, during the day, she was in pain. She was begging to breathe, like the sound I could hear from the next room. So on that day, in the morning, when we were bringing her food, we'll just open the door, disinfect, open the door, and put it on there and come back. But on that day, I was like, I think my mother, she's going to die. So I went to her and I said, listen, Mom, what can I do to assess before I can let you go? Because I was feeling like my mother is going to pass away now. The temperature was too much. But after I went out, I didn't go to my kids, and then I went to get the sanitizer, I washed my hands, I did everything. That's when I believe I got the real direct infection.
Do you think in your area where you are, people are taking this virus seriously and its impact?
People are not taking this pandemic as serious as it is. Some are still taking it is not existing. I think people, some, they still want to see it when it's happening to them directly, and some, they want to see it when it's happening to a close person to them. But for me, people, I would advise them, they shouldn't do that. And I think another advice I think the government should have done, from that day they were doing the lockdown, the mask was supposed to be like a compulsory from onset.
Nikile, hope you guys continue to observe social distancing, wear your mask, sanitize, wash your hands often, and all the best. Thank you so much.
Now, as the numbers of COVID-19 infections grow, it's important to understand how the virus presents itself in order to get help immediately and avoid infecting others. Some people infected with COVID-19 will be told that they're asymptomatic and some symptomatic, and others even told pre-symptomatic. Well, to explain these terms and how to care for someone with COVID-19 at home or in a non-healthcare setting, we're now joined by Dr. Leslie Bamford, who's the Acting Chief Director for Child, Youth and School Health from the National Department of Health. Dr. Bamford, thanks so much indeed for joining us. Welcome to the program.
Thank you very much, and good morning to the viewers.
All right, so a lot of these terms that we're hearing quite a lot more nowadays, with the COVID-19 being where it is. Perhaps let's start with them one by one. So the difference between pre-symptomatic and asymptomatic.
So the difference there is that we've known for a while that most patients who become, the vast majority of patients who become infected with COVID-19, they have mild disease. It's a very small proportion who go on to develop severe disease. What we have increasingly understood is that a large number of people become infected and actually display no symptoms at all throughout the entire period of infection. And we refer to those people as being asymptomatic. The problem is that these asymptomatic people, they feel completely well, but they are infectious and they can transmit the virus to people around them. So that's the group that we call asymptomatic. By pre-symptomatic, we are referring to people who are going to develop some symptoms during their illness, but for a period of about 2 to 3 days before they develop any symptoms, they are infectious and they can transmit the disease. So as I say, they do go on to develop symptoms. So they're not asymptomatic for their whole illness, but the pre-symptomatic phase is when they are already infected and are infectious to other people, but are obviously unaware at that point that they have developed the infection.
All right, so a vast majority of people are never going to know that they have COVID-19 or even had it. And I guess this is why wearing masks becomes really critically important, so that you're not spreading it without knowing.
Absolutely. So we don't know the exact figures, but we think that at around about maybe half of people who are infected don't develop any symptoms. But you are completely correct that we almost have to, everyone has to assume that one is infectious. You know, that the two of us chatting today, either of us could be in the pre-symptomatic or asymptomatic phase. And so that is why, as you say, we have to practice all the preventative measures all of the time. The most important being physical distancing, but also the wearing of masks, hand hygiene, all the precautions that we know about.
All right. Whilst we're talking, our viewers are going to be calling in and they might have questions. And I think we have Zanele on the line and she's in Soweto. Zanele, thanks so much for joining us. What would you like to say?
Hi, good morning. You're speaking to Zanele. I've got a bit of a question and a concern as well. I had flu symptoms last week. I'm working at JMPD as a Metro Police officer. And I think I caught flu on Saturday. Sorry, just I'm a bit distracted. I was coming down with flu. I had feverish symptoms. Then I treated the flu at home. I just bought medication over the counter. But now the challenge is, since Wednesday, I still have a blocked nose and the sense of taste. I can't taste some of the food.
All right. Okay.
And I anything at all since Sunday.
All right. Dr. Bamford, I mean, these sound like classic symptoms, particularly the loss of taste.
So indeed, there's a lot of overlap between the symptoms of COVID-19 and flu symptoms. However, as you correctly point out, this symptom of loss of taste, loss of smell, does seem to be particularly associated with COVID-19. So I think there definitely is a chance that what the viewer is describing is COVID-19. And I would advise her to phone the hotline and to get information about the next steps that she should take.
All right. And typically, what are those next steps? I guess contacting your doctor, perhaps referring you for a test or something.
That is correct. So we are moving into a phase where we have a new testing strategy where we won't be testing everyone with mild symptoms. But the hotline, I think, will be in the best position to advise exactly what is happening in Zanele's area and what she should do.
All right. And I guess people are going to struggle with, especially now we've gotten into winter officially, the difference between a cold, flu and COVID-19. Because as you're saying, some of these things start to overlap. So I guess if you're worried, first port of call, the hotline, and they'll start to talk to you and explain some of those differences, and then a decision can be made of the next steps.
Correct. Unfortunately, it is almost impossible to differentiate between flu and COVID-19. And so our strong advice is that if people have flu-like symptoms, then they must stay at home.
All right, so not everyone is going to need hospitalization. So we've got those that are asymptomatic and will go through this, probably not even realize it, just get on with their lives. But what about those people that do develop symptoms? How do you help those with those symptoms at home?
So you are correct. So most people who develop infection will have mild symptoms. And where possible, we would like those people to self-isolate at home. If people are unable to self-isolate at home, they may need to be admitted to an isolation facility. So that is a facility that really provides the same level of care that can be provided at home, but it assists people who are unable to safely self-isolate at home. People who have mild infection really have two jobs to do. They need to look after their own health, and then they need to protect people around them. So in terms of protecting people around them, they need to stay away from other family members, to isolate themselves as much as possible. Now, we do recommend that wherever possible, this means that there should be a room assigned to the ill person, and the person should try and spend as much time as possible in that room. In fact, ideally, they should stay in that room all the time, and no one else should come into that room. So that's what we mean by self-isolation. Obviously, the person needs to have meals, to go to the bathroom, etc. If possible, the person should use their own bathroom if the house does have two bathrooms. If not, when the person uses the bathroom, they should do it as quickly as possible, and that person or someone else in the house should clean the bathroom as soon as after the infected person has used it. Likewise with meals, either someone can prepare the meals and take them to the person in the room, either handing them over quickly or leaving them outside the room. If that's not possible, the person will need to prepare their own meals. Again, they should use the kitchen area as quickly as possible and then wipe it down and return to their room. The ill person should always wear a mask when they are not in their own isolated area. I think those are the main precautions that we recommend in terms of limiting
the spread
transmission to other people. Of course, we encourage people to communicate with others digitally as much as possible, to phone, to WhatsApp. If they need to talk to people, people should come and try and stand outside the room so that they can transmit or talk to people if that is necessary.
All right, let's take another caller. I believe I've got Wilson on the line. He's in Gauteng. Good morning, Wilson.
Morning, Peter. How are you?
Great, thanks. What's your question?
My question is about the testing. My wife tested positive 19 days ago, and 3 days later, I took my kids to the clinic for us to test. They told us there are no swabs, but we should go home. No one will be sick. 3 days later, they came from the department they took us at home, and they didn't do anything. They told us they don't have anything. And my wife went to Lancet, because she had tested positive from Lancet. And they told her to get a medical certificate from the doctor, which is a referral to Lancet. They can't free test her. So now, 19 she's still at home without any test, because you can't get a medical letter from any doctor.
All right, okay. Dr. Bamford, I'm sure that this is something that's coming through quite a lot as the system starts to get loaded quite a bit. There was a time you could present yourself to a laboratory and do a voluntary test if you wanted, but it seems that extra layers are being put in now, doctors' referrals, and we've got this caller saying 19 days later, after testing positive, they're still unable to get tests done.
So I didn't quite hear the whole story. So in terms of the person who's tested positive 19 days ago, there is no need for her to retest. Our recommendation is that 14 days after onset of symptoms, she can do what we call de-isolate. So that means that she can stop self-isolating and she can return to work. There's no need to have a repeat test, particularly if sounds as if she's had mild disease, she hasn't been admitted to hospital. And in those circumstances, as I say, 14 days after the onset of symptoms, the person can de-isolate without a test.
All right, some employers
In terms of testing of contacts,
yeah.
So again, we do not recommend that all contacts are tested. Close contacts need to what we call quarantine for 14 days. And basically that is the same as self-isolation. They need to be closely monitored for symptoms, and if they develop symptoms, then they should be tested.
All right, some employers are saying that if you've tested positive, that you can only come back to work after you've had another test that says that you're negative. Are you saying that employers shouldn't be demanding a second test?
So unfortunately, there is some confusion about this, and there was at one stage, there were some regulations that were issued that did indicate that a negative test was required to return to work. These regulations have been amended, and it is now made clear that the person should be assessed by a healthcare worker, but that assessment does not need to include a test.
All right, and then perhaps...
we in fact know that many people who would be tested at 14 days may test positive, but that would in fact be what we call a false positive, that although they test positive, they are no longer infectious. And so for that reason, and for the fact that we need to use our tests as wisely as possible, so for both those reasons, we do not recommend repeat testing, and the labour regulations have been amended to be in line with this.
All right, and then perhaps finally and briefly, if you can, treatment of symptoms. Do we use the same remedies we've used for colds and flus, lots of liquids, vitamin C, those kinds of things?
Absolutely. So the treatments that we recommend for mild cases are plenty of rest, bed rest, paracetamol for fever and for pain, and then just to make sure that the person is taking adequate fluids. The other thing that is important is that symptoms are monitored, because people with mild disease, a small proportion of them will go on to develop more severe disease. So if the person is experiencing increasing shortness of breath, particularly if they're short of breath at rest or just when they're walking to the bathroom, if the person becomes extremely sleepy that they cannot be woken up, or they become confused, or if family members can see that they have blue lips, then those are what we call the danger signs, and those patients need to then urgently seek medical care.
All right. Dr. Bamford, we're going to leave it there. Thank you so much indeed for those valuable insights on the program today.
Thank you.
All right, thank you so much. Okay, that was Dr. Leslie Bamford, Acting Chief Director, Child, Youth and School Health from the National Department of Health, with all of that advice. And please make sure that you watch this program again and again on our YouTube channel, just to make sure that you get some of this information. All right, let's get some of your messages. Some of you have been writing in via Twitter and also on WhatsApp. Let's start looking at some of those messages. All right, so Kedibone says, I finished my 14 days isolation period on the 16th of June. I drank lemon, ginger, garlic and turmeric concoction. I did steam inhalation with Vicks in the mornings and evenings and took the attached combo of flu and immune support meds. And that seems to be some of the traditional things that we use for colds and flus, and I think that was recommended as well. Googs says that I'm on day 2 of quarantine today and feeling so weak and a bit of nausea. Can't taste my food today, but hoping that tomorrow will be a better day. I have a cough here and there. Been sleeping most of the day today. Well, let's hope you get well pretty soon, Googs, but stay in quarantine as you're rightly doing. This is from someone who calls himself Goat. Today is day 9 since I tested positive for corona. I don't have any symptoms for corona. I use these two to steam myself every night before sleeping. Okay, so that's his remedy. Benny says, what I failed to mention is that every 3 hours we wipe all touch areas, door handles, lights, switches, fridges, handles, microwave, remotes, keys, taps, kitchen and bathrooms with a sanitized cloth. Create a waste bin for all disposable PPE, masks, gloves, etc. That is great hygiene, Benny, and great tips for all of us to follow. Levi Masilo says, I just got this post and it's encouraging to hear that people are winning from this pandemic. My challenge is that I travel with my colleagues to work and they all drink and smoke and they don't seem to care about what they claim that they are not infected. All right, that's very irresponsible for your colleagues to do. Renzo says, on the cases that will be counted today, my sister will also be included for COVID-19. I got it from a patient and so I'm so shattered I can't even be there for her. She's just crying. Oh my goodness. People are recovering. The vast majority of people are recovering, so don't stress too much about these things. Bongio says, I'm on day 2 of quarantine and I'm feeling really sick today. My nostrils are very dry. It feels like they're cracking when I breathe, so I have to breathe through my mouth and I've got a terrible headache. All right, well, we're also hoping you get well soon, Teacher Bongi. And that was the last tweet. Thanks so much indeed. In fact, I think that's it. All right. Okay, so now, you know, one of the things that we have seen during the pandemic, sadly, has been the stigmatization of testing positive to COVID-19, with so many people having had, and possibly many still more to get infected. The last thing we should be doing is stigmatizing those infected. One day it could be you or your loved one. So we're asking those who have been diagnosed with COVID-19 to share their stories with us, to try and give this pandemic a human face and try and stop the stigma. Importantly also to try and encourage others. And this is what inspired Dr. Masego to share her story with us. Let's take a listen.
I'm Dr. Masego Meya and I recently tested positive for COVID-19. This is a virus that has instilled fear in the hearts and lives of many across the world. Stigma stems from this fear, and this fear stems from lack of knowledge. Our South African statistics have shown us that the vast majority of people recover from this virus, and the symptoms for many are flu-like, mild, and treatable. I encourage you to join our efforts on social media to eradicate the stigma around this virus by following and retweeting our hashtag #RealPeopleTalkCovid, where we educate each other about this virus and also create a safe space for people that test positive for COVID-19. Let's support each other as a nation, as a people. We will get through this. Thank you.
Okay, so everybody, let's share our stories. Let's give this a human face so that we get an understanding. It's actually ordinary people like you and I who are getting this, and it's going to go for most of us as well. Some of us will probably need to get help, but by and large, most of us quarantining, treating the symptoms should get us through. All right, so our question for this week, just a reminder again, is what has been your experience with isolation after testing positive for COVID-19? And what treatments did you use to manage those symptoms? Please send us your voice notes or video calls on our WhatsApp number, and that's 065 862 4548. 065 862 4548. You can also share your thoughts with us, of course, on social media via Twitter using @SABC Health Talk or #SABC Health Talk. Now, after the break, we speak to the divisional head at the Ezintsha, a subdivision of WITS's Reproductive Health and HIV Institute, Professor Francois Venter. Stand by for that. Interesting chat about vaccines and also dexamethasone.
A research team at Oxford University has found that a cheap and widely available drug called dexamethasone can be effective in very severe forms of COVID-19. Understanding the intended use of the drug is important. That is according to Aspen Senior Executive Stavros Nicolaou.
Dexamethasone is an external source of cortisone that patients take to assist with conditions that require an anti-inflammatory response in the body.
How does the drug benefit COVID-19 patients?
Dexamethasone, being an anti-inflammatory, reduces inflammation and potentially would assist patients with the fibrosis that I explained in the liver, in the lungs, and it also probably has some effect on the clotting mechanisms of the body, because what you are finding with these patients is that patients are developing clots, they're called microclots in the lungs, and it is seemingly from the Oxford study that dexamethasone looks to, through its anti-inflammatory effect, assist these patients that are in respiratory distress.
Dexamethasone was shown to be effective on critically ill patients, but can an asymptomatic person use it?
Their results, their preliminary results or findings, are in those patients that were severely or critically ill with COVID. So they haven't demonstrated as yet, and there's ongoing studies to this effect, but they haven't demonstrated as yet any benefit in those patients who have a milder form or mild symptoms of COVID. The study was very clearly aimed at those patients who were critically or severely ill.
What about dosages and accessibility?
Make this product available in two dosage forms, in an injectable form, which doctors would inject directly to patients, but it is also available in a second form, which is a tablet form, which patients would swallow. So, short answer is yes, the product is available in South Africa in an injectable form, and certainly we can make the tablet form available if required.
Well, South Africa is in a good position to immediately roll out dexamethasone, as you've been hearing, and that's according to the Department of Health. Meanwhile, South Africa has also joined various parts of the world in beginning vaccine trials for COVID-19, with 8 participants being the first to vaccinate at a health facility in Johannesburg this past week. Well, to understand these treatment methods, we're now joined by Professor Francois Venter, who's the divisional head at Ezintsha, a subdivision of WITS Reproductive Health and HIV Institute. Thanks so much indeed for joining us. Welcome to the program.
Hi, everybody.
All right, so let's start with the dexamethasone, actually, because a lot of excitement was raised the last sort of 10 days about this. And I guess all it is just another line of defense for high care patients.
So yes, it is, and it's difficult to weigh. On the one hand, I think everybody just needs to understand that this is preliminary data. It still needs to go through the usual research bureaucracy in terms of peer review, but it's a very reputable group as opposed to a lot of the other research that came out over the last few months. This is a pretty well-conducted study on the face of it, but we need to get those results. If it proves right, though, it is only an intervention for a small number of people, but it's the small number of people who desperately need it. You know, with COVID, what we're worried about is the people who end up in hospital, who need oxygen and who then need ventilation and who may well die. This drug specifically focuses on them, so it's quite a big step forward. Without getting too excited, I would say that this was pretty major. It was a pretty major breakthrough for COVID treatment, as long as the results pan out.
Yeah.
We've got here a drug that's cheap, it's got a relatively good safety profile, and it's immediately available in South Africa at volumes for the patient population who needs it most.
And I suppose it really has to be high care because the side effects are not always great, are they?
The side effects of this particular course of drugs, they're certainly there. And, you know, it's a steroid, and I think many of the people watching will have had everyday experiences with steroids with use of asthma. It's quite an old steroid, actually. We used a lot of it for head injuries. We used it in some of the anti-inflammatory process, and we used a lot of it in cancers. So it's readily available. We know all the side effects associated with it. So that's really good news. And it's relatively cheap. There's a lot of focus on trying to get the cost down, but it's also manufactured locally, which is a big win.
All right, but again, to be clear, it's not a cure. We're not at that stage with any drug at this stage.
No, it just deals with the severe consequences of COVID. There's no cure at the moment. There's another drug which is slowly being made available, hopefully in the future, called Remdesivir, which just decreases your hospitalization levels by a couple of days, which is also a fairly big deal because that's what you need. You need to get out of the hospital where there's a lot of other things that you can catch. But those two drugs at the moment are the only two things, and they only treat the consequences. They don't stop you getting it, and they don't. It's not really a treatment for everyday people. In Joburg, we had an advertisement of some drive-through dexamethasone, come and get your dexamethasone thing, and it's been shut down, luckily. But you know, the drug didn't show any impact on people with milder forms of disease. It's only once you're staring down oxygen and you're looking at a ventilator, that's when the drug really works.
All right. So one of the things that I've heard about dexamethasone is that it can depress your immune system. And so, you know, when we're talking about COVID-19 and immunity, is there a danger there, or is the exposure to a depressed immune system quite short? What's the story?
So the study that looked at this didn't actually, as I said, it's preliminary data. We do need to get the final results in, but actually didn't show much in the way of side effects. It is a combination, it's a drug class that is associated with immune suppression, and certainly, you know, when you're using it, it's not something you go down the path of lightly. It's certainly a very powerful drug, and it has got immune suppressive impact. When we've used it in other contexts, it does seem to have an impact on fungal infections and increased susceptibility to that. So that would be something you'd need to think about. Having said that, you know, COVID makes you really sick, and when you've started to look at oxygen and you're on oxygen, that's the time when you really, you know, you have quite a lot of leeway when it comes to side effects that you really would want to, in that situation, I don't think the risk-benefit ratio is very, very, very easy to take on. You wouldn't want to use it in mild disease. As you say, the side effect profile there wouldn't justify it. And there's no impact in terms of how you do.
All right. So the other very optimistic development is this vaccine trial. We've had our first cohorts being vaccinated this past week. And tell us a little bit about, what is a vaccine? Let's get clarity on that.
So very just in layperson's term is what you try and do is you almost you give almost a decoy to the immune system. You have something that looks like the virus that you try, or the organism that you're trying to vaccinate against, and you almost fool the antibody system into producing those antibodies and stopping the so that the antibodies are there. So when you actually see the disease eventually, you're able to clear it out without any problems. So it is very exciting, and we've got reports of people queuing to get into the vaccine studies, which is really remarkable and amazing testament to South Africans. And it's a huge human commitment to go into a vaccine study because we don't know whether it's going to work or not. Having said that, there are lots and lots of vaccines in the wings. There are 2 or 3 that are already, as you've heard, on their way to South Africa. And we just have to be patient and hope that this pans out. It's important to understand that in research often, in fact, most of the time, when we investigate something, it doesn't work. And we're in an emergency situation here. People have moved extraordinarily quickly, but there are not going to be like quick wins. I mean, I hope I'm wrong, but the likelihood is that some of these vaccines won't work out. We've had multiple HIV vaccines that haven't panned out, unfortunately. So with a little bit of luck, these will. There's some basic science suggesting that it'll be much easier to do this vaccine than, say, for an HIV vaccine or some of the others we've looked at. So we're all holding thumbs. I think as a country, we desperately need some good news around this, and that certainly would be the case. Unfortunately, it still has to go through it has to be shown to work, and then we have to manufacture the stuff, and then we have to give it to everybody. Yeah. So there's still a lot of big steps to be taken in between.
But I mean, to get to human trials, you've already got good indicators, I guess, to get to even to that step.
Yeah, and I think that is quite extraordinary, and it really does talk to an international collaboration. I think South Africa is also really lucky because it's got some of the best vaccine researchers in the world. And they've done some mind-blowing stuff. Maybe the public isn't aware of this, but certainly a whole range of vaccines, including flu vaccinations. Those studies have been done in South Africa and saved millions of lives, probably internationally. So this team was ready to go when these vaccines became available to be tested.
All right, so take us through the trial process. What happens typically? I know some people are going to get a placebo. What is that, and what happens?
So we have to know it works. This is going to be, you have to ramp billions of these doses up. So you have to compare it to something, and we don't have anything that stops you getting COVID. So we have to compare it to nothing. And so what we do is the placebo is just simply an injection that looks and feels exactly like the vaccine, but doesn't have the active ingredient in it. So it would essentially be water that you're injecting rather than the vaccine. And the reason we do that is we also have to work out, are there harms associated with the vaccine, as well as does the vaccine actually work? You don't want to roll out something that doesn't work, obviously. So you have to compare it to something. So what they'll do is enroll large numbers of people. They will make sure that they don't have coronavirus at the time that they go into it. Half will get the active vaccine and half will get the inactive vaccine. And sometimes with some of the study designs, they'll give you different doses of the vaccine as well to see which dose works most optimally. And that may be coming in the future. But what they normally would do is compare it to nothing. And then they'd follow you. They'd see, do you get coronavirus? They would do that by watching whether you get sick, whether you don't get sick, whether you develop antibodies to the virus. And they would also make sure that the virus, that the vaccine is actually safe. So they would watch you for side effects, at the injection site, they'd see whether there's pain, whether there's swelling, whether you have any sort of allergic reaction or anything like that. It's very unlikely with this class of viruses. And the people who make these viruses are incredibly experienced. So we're not expecting any problems, but that's we need to do. If you're going to pump this into all the South Africans in the country, we need to make sure it's safe and it's effective.
So timeline in terms of the trials, what are we looking at?
Look, as I said, I'm absolutely flabbergasted how quickly I've got this thing up and going. And again, it's a testament to the researchers and the basic scientists who developed these things. But we're looking at results within a year. I know that sounds like a long time, but by vaccine, studied sort of results, that's not a long time at all. But then, as I said, then the thorny issues are going to be, can we manufacture it? And if we do find a result, we're going to be competing for these vaccines with the whole world. And rather than with a couple of million Africans, we're going to be competing with billions of people around the world. And so this is going to be a logistical exercise that everyone's going to have to get behind. So it's not just a question of getting the research through the door. It's also a question of getting the manufacturers up and running so that they can be able to split these things out and then ship them to us as quickly as possible.
All right, well, we'll keep our fingers crossed and good luck. Thanks so much indeed, Prof, and we'll chat to you again in the near future to see how things are going.
Take care.
Great. Thanks so much indeed. That's Professor Francois Fenter speaking to us about these vaccine trials and also, of course, dexamethasone. All right, let's get another look at some of your messages. And this is what you've been saying to us. Let's put them up. Okay, so this is from WhatsApp. Morning, Peter, and the viewers of SABC. I've recovered in isolation at home, practicing infection control prevention measures to living with me here at home all the time from COVID-19. Know it happened as a blessing for me to help almost all people in my community and outside my communities around Cape Town City. You can hardly see statistics of Western Cape recovery is high. Just a few in other menace societies, people who are not adhering to regulations. All of this coming through WhatsApp, and this one, please say your names in the future messages so that we can know who we're talking to. This person says, I have a 1-year-old boy. Should I take him with me for isolation? Because I don't think self-isolation will work for me. All right. Call the hotline. They will give you all the advice that you need about some of these issues. Top of the morning to you, Peter. Can I also encourage people with symptoms to at least try to use cayenne pepper, ground ginger, garlic and lemon, boil them and drink that mixture in the morning and in the evening. It's really helpful. Again, most of these remedies that we use for colds and flus seem to be working for this as well. Hi, I was diagnosed positive with COVID-19 and I've been self-isolating for 10 days now. I have no symptoms at all, but would like to know if I must retest after 14 days again and you can get COVID twice. Well, what we're told is that after 14 days, actually, you can start de-isolation and start to go back to work actually, but carry on practicing the safety drills, the regulations, washing your hands and that kind of thing, sanitizing, social distancing. So that I think is your answer. Good morning, P. I'm on day 3 of quarantine, was diagnosed by one of the doctors where I work, still waiting to be tested at home as I was told I lost my sense of smell and taste, hence I was sent for quarantine. Yeah, very important. Stay at home. Contact the hotline if things develop, but by and large, stay at home for at least 14 days. Your symptoms will come, some might not come, but if you start having things like shortness of breath, that's when you start elevating to the next level. My name is Puseletso. I am a healthcare at local clinic in Ekurhuleni South, and I tested positive on the 16th of June, and unfortunately I infected my little sweet daughter of 7. She's not been sick, thank God for that. She only had a headache and a sneeze here and there. Today's day 12 and generally okay, but still have a little cough here and there. I'm grateful for my husband, my mom, my mother-in-law for all their support, and I think family help and support very important in this kind of environment. Ntombi Futi says, I'm on day 8 of self-isolation after being tested positive for COVID-19. I'm doing very well, even though at first I was scared and crying a lot. I had flu-like symptoms for a few days. Later I lost my sense of smell and taste. I was treating my flu symptoms and steaming every day with Vicks and Umsuzwane. I drink ginger, lemon, garlic and cinnamon concoction and some immune boosters like umhlonyane. I sleep a lot and drink lots of water, and I'm doing very well. Have been regained my sense of taste. Real people talk COVID. Thanks so much indeed for sharing your thoughts with us. And that's where we come to the end of the program today. Thanks for our guests and you watching at home. Stay healthy, wash your hands, social distance, sanitize, and wear a mask wherever you go. Take care, everybody. Bye-bye.